Good morning. Thank you for waiting. My name is Dr. Tracey Guthrie, and this is my colleague, Dr. Camila Cosmo. And we do this crazy thing of a podcast. And we'll tell you a little bit about how that came to be. But I want to welcome you this morning. Welcome to Alumni Weekend. I hope you're able to enjoy the beautiful weather and the beautiful campus. And we've been doing this project that is for the lay public. It is for people that are not psychiatrically trained, that don't have any training in this, but we're all living through a process of things that affect our mental health every day. And so what we wanted to do is create a podcast that reached the lay public. This was not my idea. I'm the vice chair for clinical faculty affairs in the Department of Psychiatry and Human Behavior here at Brown. I'm also the program director for the Psychiatry Residency Training Program. And I felt I was really busy enough. And a podcast does not float up to things that I wanted to do. However, I have a very persuasive resident in Dr. Cosmo. She graduated last year. She's now on the faculty here at Brown, working at the Providence VA Medical Center, and is on our teaching faculty as well. And she convinced me that this was an imperative that we should do. And as usual, she was right, and it has become a very integral part of our residency program and a meaningful piece of work of what we wanted to do with the community. Good morning. Good morning. Welcome. So that's how we came to be. Dr. Cosmo is going to tell you all about her vision, because it was all her vision.
Our vision. Good morning, everyone. It's a pleasure to be here today. Welcome to the Family Weekend. And we appreciate you taking the time to be here. We know that we are competing with yoga and all the activities that are going on. So we do our best to entertain you in the next minutes and hopefully do this as fast as possible so you can grab a second cup of coffee before the next activity. So we'd like to talk a little bit about our vision, how this podcast came to life. So what we envisioned was to promote universal access to mental health education. So this idea came up around 2.5 years ago amid the COVID-19 pandemic, as you all recall. During that time, this idea was born from a mix of frustration over the epidemic of misinformation that we are also facing at that time. And as you remember, a lot of people were really having their lives impacted by that, their health. Unfortunately, a lot of people were gone because of this misinformation that was spread. And there was like a mix of that plus a sense of gratitude for having the opportunity and the privilege of being trained here at Brown, having access to outstanding lectures. We have amazing professors, and we also have access to top-notch science, as you all can imagine, and most importantly, reliable data. So I'm sure that you have been looking around and you are familiar with Brown, so you can see how much Brown has to offer. We have an amazing structure and countless resources. And something that we keep in mind, and I say we because there is a whole team behind this idea, it's that we do not want to take that for granted. So you understand and you want to we cannot lose the perspective of how privileged we all are for having that. Unfortunately, as you all know, most of our population here in the US and globally do not have the same reality. And from this reflection and wondering how we could collaborate to provide education and bring this access that we have to other people, rather than solely being the recipients of that, this is when this idea came to life. And at that time, I remember reaching out to the leadership at Brown, and as you all know, Brown welcomes ideas and make this happen. Our esteemed Dr. Guthrie, she was very receptive to the idea. She embraced that because, an idea could be just an idea. The thing is when those ideas are brought to life by people that really embrace that and believe. So she did that. She worked her magic. She was able to find funding for this project. And I remember when we had our first meeting, it's when we came up with what exactly we would like to do. Because let's be honest, we are not inventing the wheel here. Podcasts are out there for many years now. And at that time, we are kind of wondering, okay, what exactly we would like to do? What would be unique about this? How we can help our communities with a tool like that? And so this is when we came up with this mission to make science-based knowledge accessible and comprehensible to everyone by adopting a conversation approach on media platforms. So you'd like to keep this simple, to make like science accessible to everyone, to anyone. And I remember that we were having these discussions at the time, and we are joined by Dr. Alves Olivares, who is a esteemed professor in our department and has an extensive experience with radio. He has been working like in recording this program for Spanish speakers. And he was helping us to shape the idea of this podcast and how we could be able to accomplish this mission and what would be our goals at the time. And so together we are able like to brainstorm that idea and start to work. And we came up with the sense of, okay, what is our goal here? What we want to do? How we can embrace this mission and make this happen. And our main goal, as I was mentioning, is to promote universal access to mental health education. But our ultimate goal is collaborate to dissipate the stigma that is associated with mental health disorders and also facilitate access to care. In order to do that, we have been like through our episodes, you get a sense about what we are doing. We have been trying to normalize conversations about mental health. We know that this is a struggle for a lot of people. As a society, we have improved a lot in the last years, especially after the pandemic, but we still have a long way to go. So we have been trying to talk about different topics and trying to like encourage people, empower people with information to be mindful about their mental well-being and also to be able to help others. Dr. Guthrie will talk about our core values and give a better sense about what we are going through.
So, this is pretty much as Dr. Cosmo said, we really want to destigmatize mental health. There is no reason that this should be stigmatized. I've been a psychiatrist for a lot of years, and there is nothing different about a mental illness than a physical illness. So I really think that we need to get over that. And I don't have any other way to say that except to say it that way. We, as Dr. Cosmo said, we really do want to acknowledge that there's a lot of incorrect information out there and people are suffering as a result of that incorrect information. So when you're at an institution that has people that are, international leaders and have the data to support what they say, we wanted to provide a vehicle for them to speak. Because most of the time, we find that the fact that we work with are afraid to speak out. They don't want to be blacklisted on social media. They don't want to be attacked. And we can't do that as physicians. We are not able to sit idly by while incorrect information is put out there and people are suffering. So this vehicle also provides a space for our faculty to feel comfortable to be able to do that. But we've had to work with them to be able to feel comfortable to do that.
That's true.
We wanted to model to our residents that this is your responsibility. Our residents are in training. They're watching everything that we do. If we do not act in the way that we want them to act also, they will not do so. So we wanted to say it is your job to give back to the community. However that is for you and whatever millennia you're going to be working in, you actually have to do that. And so we wanted to model that to do community outreach. And we also wanted to do this in a multilingual platform because we're privileged to have people here who are multilingual. So our first episode in Portuguese will launch in December, and then Dr. Alves Olivares, who you'll hear a little bit more about later, will launch it in Spanish at a later date. So then all of our things will be in at least 3 languages, maybe more.
Yeah. We are working also to transcript the episodes in different languages, and hopefully some residents will join us in this endeavor. So
the timeline. So this timeline is just basically way too long for Dr. Cosmo. She wanted me to do this in about 6 weeks, but it took some time to sort of do. So there's the initial idea, the talking. We decided we had to have an editorial board to keep us honest, that we had to have people, we had to have a mission, a vision, a purpose. And so we invited board members, and thankfully people are very excited about this idea. We then tried to pick topics that were important. Our first episode was on suicide. And we think that that's important. We needed to do that. And we had to review the evidence, get the data. And who does this is the residents. The residents are the script editors. So they go through all of the information, they collect the data from primary resources, and they're the script editor. There could be more than one script editor, and then that editor joins us in the recording with the experts to answer these questions. So this was imperative to me to embed it into the residency training program. So we had to get the equipment. So how do we get the equipment? We're a residency program. We don't have any money. And there's only one benefit. There's several benefits to being around for a long time. You remember things. And about 20 years ago, and maybe a little bit less than that, Alvaro Oliveras is an attending at Butler Hospital and on our faculty here at Brown. And he used to do a radio show called Mental Health with Dr. Oliveras. He did it for over 15 years. It was in Spanish every Saturday. It eventually made it to Latino public radio. He had this idea, so he was probably the original idea person, to build a radio station inside Butler Hospital and to educate the community about the research going on here so that the community would be less afraid. Marginalized communities are very afraid of being involved in research. So he wanted to do that. And so the president of Butler Hospital at the time, Pat Recupero, launched a little fundraiser and asked physicians and staff to donate to this. So we did. It never came to fruition, but I remembered the money existed. And so, but I didn't know how much it was. I didn't know how much was there. I didn't know if it was, but it was actually a fair amount of money. So we were able to fund our equipment, which were digital cameras, a mixing board, lighting, high-end microphones. All of these things had to be purchased, and that's how it was purchased. So it's really Al Oliveras's work from the past that's coming to fruition now. So I certainly want to give him and Pat Recupero credit, and also Mary Marin, the current head of Butler Hospital, for allowing us to use that money for this purpose. Mm-hmm. And then we launched our first podcast in May of 2020.
Yeah. So this is how our website looks. We have also a website that's bearingmindpodcast.com. So we would appreciate if you can access that and help us to spread the word. And in this website, you'll find our editorial board and also information about each episode that we have available. And through there, you can also access our social medias. Right now, we are present in different social medias, in almost like all the main audiocast platforms. We have at Spotify, Google Podcasts. We also have this available at Facebook, Instagram, YouTube, Twitter, that now is X. So through all our medias, what we are trying to do is to expand that and try to make this accessible to as many people as possible. We are debating about TikTok. It's the only one that we are still figuring out if we should go for it or not. But again, our goal is to keep this simple and reach as many people as we can and make this available for a broad community. So here we can talk a little bit about our episodes.
Right. So these are our episodes so far. We just launched the first part of our episode on addiction, but suicide prevention with Dr. Lauren Weinstock. These are all people that I know. These are people I passed in the hall, and they look rather ordinary, and they're not. They're unbelievably extraordinary in what they do, and the depth of understanding of what they know. They are the top of their field until they get into this room, and then they're unbelievably anxious, and they think that they can't do anything, or they didn't quite know we were going to video them as well. And there's lots of feedback about that. We have several more in the queue that are being edited. We've recorded more than these, but we release about one a month. Yeah, you want like
we are walking to have more.
Like a lot. But these folks are unbelievable, and we really had them try to target an appropriate lay person level. So these are our recent episodes, and more to come.
Yeah, and we would like to take you. Let me go there just a click.
Right. So this is what my office typically looks like until Camila gets a hold of it.
So she is very generous, as you see. Besides working her magic and making this possible and finding the funding, She also let us use her office. So this is her office. And we have the opportunity to set up our studio there and use once a month to record a few episodes. And here we have our audio and video producer, William Cosmo, who has helped us to record the episodes, help us also to keep grounded and like not use our medical lingo. So whenever we are finding ourselves lost there, he grounds us and asks us to come back and keep it simple. So as you can see, it's not exactly Pixar, but it's pretty cool. We have been able to do fun stuff with that and like provide information. And here is our, let me go to our tasting platter about a few episodes. Please go ahead.
Just hit one. Let's people.
I think as much as we talk about warning signs, it's also important to remember protective factors as well. And so just remembering that access to care and support is an important protective factor. Feeling connected to family, community, feeling a sense of belongingness can be really important. Having abilities to problem solve difficult life experiences can also be protective, and also limiting access to means that somebody could use to harm themselves can also have a protective role.
How can we differentiate between normal forgetfulness and Alzheimer's disease?
So that's a great question, and oftentimes it's a very subtle difference. So, I think about, and what I often describe with patients is, if you've noticed a change in your daily activities, so you're needing more assistance with things that you used to be able to do, one of the most common presenting symptoms that people come to us with were short-term memory difficulties. And so you often hear that we're asking the same questions over and over again, needing more support and assistance. But if you have any concerns, it's really important to be evaluated and bring those to your primary care provider so you can have a more thorough evaluation. Because oftentimes what is associated with potential normal aging may actually be an early Alzheimer's dementia process.
These are all things that can really help protect the mental health and well-being of your child that are just as important as all that time you spent picking out that child seat, to bring them home safely. You want, it doesn't end. The attention and focus on this matter doesn't end.
I think as a parent, right, if your child's having a hard time, your natural inclination is, I want to do everything to support my child. I want to do everything that I can do to make them feel better, to get them to feel happier.
Right.
But in reality, a lot of times, for example, okay, my child's calling me from school. They're having a hard day. It's okay. So I'll go pick them up and let's go get our nails done because that's going to make them happier and feel better. In reality, some of those things can really sort of enable the underlying mental health concerns. So for example, kids going to school, right? Okay, I can't go to school. It's okay. It's okay. Over time, makes it so much harder for a kid to actually get into school.
Yeah, so as you can see, besides all the roles that she has and she performs, she is also our podcast host. So we are very grateful for that. It was a long process to convince her, and I'm glad that she accepted because this made a huge difference in the process.
These are all things that can really help protect. So these are our editors. We want to thank them. They really bring their expertise and perspective. Dr. Alves, Dr. Laura Whiteley, who's our associate program director, Dr. Jose Rengifa, who works at Butler, Dr. Thiel, who works here at Brown, and is a researcher in his own rights. Dr. Oliveris, Dr. Whiteley, Dr. Thiel are all graduates of our program. Dr. Collins and Dr. Johnson are current residents in our program, and Dr. Collins is one of our chief residents. We have William Cosmo. The name may sound familiar. He's, it's what happens when you're around Dr. Cosmo to get sucked into things. So her husband is our audio video producer, and he really does have the layperson lens and helps us to stop talking in jargon or expand on things that he thinks that are the next question that people are going to have. These are our residents out at the Bristol Yacht Club, and they're the reason why we do these things, and also at their retreat. And of course, Katie Leisner is our communications manager for the Department of Psychiatry and Human Behavior, and she's also been integral in getting our voice out there. So we're grateful to her.
Yeah. And here are a few QR codes that will give access to some of our medias. We would
Yes,
appreciate
we need your help. Spread the word.
if you can,
Like, subscribe, whatever those words are that people use today. We really do want to get the word out and get better and better at doing this. So give a listen on your favorite platform and spread the word. We would
Thank
love
you
that.
so much. Yeah, we
We'll be
appreciate
happy
your
to take
time.
questions. Any questions?
Oh, please.
Yeah.
So you mentioned one of your objectives was to reach multiple communities of different languages, and with the advent of ChatGPT and AI, you could actually do those podcasts in simultaneous translation, but also there's now apps out there which will actually kind of mimic or directly show the lips moving with the exact words.
This
would be in the on-demand version. I don't know whether you can do it live.
Yeah.
But certainly on the on-demand version. I'm just thinking about the efficiency of being able to produce something cost effectively.
Yeah.
And be able to kind of put that out there, much more simply.
Well, no, you're right. It is a great deal of time, and effort. So that's very interesting. That's a very helpful perspective. We are venturing a little bit, very judiciously into AI. We're actually moving into another program to do our entire call schedule using AI, because that's another time sink. So we are quite open to that. So thank you for that suggestion.
Excellent idea. Thank you very much. This will be extremely helpful. Yeah. We'll save a lot of time.
Other
any other questions,
thoughts, or topics we should cover?
Oh yes, this is a very good point.
Yeah.
Any suggestions?
Things you want to hear about?
What's the process for choosing what your topic you would like?
Yeah, that's a very good.
Excellent question. Yeah.
What is our process for choosing our topics? Because there's a lot of things we could call that fall under the umbrella of mental health. Is that accurate?
Indeed.
So we try to choose topics that wind up being discussed quite a bit in the media. So suicide tends to be talked about in the media, but and people get lots of links. If you're suicidal, this is what you should do. But we wanted to talk about what it looks like in actually being with someone in your life who's suicidal, and what could you do if you're with that person? What should you not ignore? What action should you take? So we wanted to talk about suicide. We want to talk about addiction. We want to talk about child mental health, because it's a crisis in the country right now. We want to talk about Alzheimer's disease, not only because we have one of the national sites for Alzheimer's research, and we have, experts here, but it is a very large problem it's like someone dropped a bomb in your life when you have someone in your life who has dementia. So we wanted to talk about things that are of value and of note to people who are dealing with this. And that's how we choose them. We really try to get people to focus in on a particular aspect of their care. We're going to do more. We're going to do stuff on homelessness and mental illness. And what that is and what it is not. We're going to do stuff on violence and mental health. So we're trying, if it's a hot topic that no one wants to talk about, we're going to talk about it.
Yeah. And usually those suggestions come from the residents.
Yep.
And then we get together in the editorial board meeting. We discuss and try to decide what would come first, what would be more important, what is more relevant, what have been discussed.
And who's the expert?
And who would be the ideal person to be able to talk about that properly. And we try to keep that as open as possible.
Right.
And another thing that guides us also is that we have many months that we celebrate mental awareness.
Yep.
So for example, for this month is the substance use awareness month. So we had this plan ahead, and this was something that Kate brought to us when we released our episodes. So this is another thing that guides us through. But again, if you have suggestions about topics, we are open and we would appreciate that.
Yes.
Maybe I might have missed this, but how do you promote the population audience to listen to your information.
Yeah, yeah. That's what I mean.
This is exactly where we are working. We have been discussing that over and over. We are trying to amplify that. Right now, we are advertising through Brown. So if you look at the different Brown media, you find information about our podcast. But of course, our goal is not to be just restricted to our community. We appreciate that, but our goal is to reach as many people as we can. So we have been trying to use, like, as you could see here, those shorts, those reels. Those are strategies because, let's be honest, not everybody has 30, 40 minutes to sit and watch or listen to an episode. So especially today, you see that people use social media. Sometimes they spend like a few seconds on something and then gone. They just like scroll and see something else. So one of the strategies that we are using is like creating those shorts and sharing through the different medias. This is why we are like debating about TikTok. And we hope that through that we can like amplify. But again, we count with everyone's. So this is why we are kind of like asking and encourage you to turn in and share. And we hope that over time you'll be able to broaden our audience.
I mean, it's why we're here. We
Yeah.
want the alumni to know about this. We want, people to know about this and spread the word. So we'll go anywhere and speak to anyone about this.
Oh yeah.
But we're just getting started, so we'll learn as we go. But it is social media. It is through the hospitals. We want our patients to listen to this. We want them to share this information. Our community partners, we're spreading the word. We have posters up with our QR code
codes.
everywhere so people can access it. And I talk about it everywhere now. Yes.
Yes, I work at a university environment as well.
Oh.
And in higher education, in this country and others as well, the idea of the mental health crisis among students is pretty well publicized and discussed.
Yes.
And I just wonder, is there a version of this that you could think of that would be more targeted toward the 18 to 25 or 26-year-old population around their lack of knowledge, their newness to their own independence, and the struggles they have around mental health?
Yeah, I mean, so I'll just talk off the top of my head, and maybe Dr. Cosmo has some ideas. But as we were to go forward, we could create certain tracks for people. So we could create a track of podcasts that lends itself to, here are 5 things that 5 podcasts would be really helpful as you're going off to college. And here's 5 podcasts on being a young parent and working. And what you feel insane, and what does that? Are you really? And no, you're not. Here are some podcasts about midlife, and what am I doing, and why am I doing this here, and what does that mean? And also the existential crisis of what now? Now that I'm at the end of my career, and I'm taking care of. I have kids in college, and I have an ill parent, and how do I do that? I could see tracks of things of that nature, where we could think about that. But that's
exactly. No, I agree. We are building a repertoire right now. We are recording like different episodes, and we hope that at some point when we have enough, we'll be able to like have those different series available. Yeah. And this is exactly what we expect, like to create and have those different niches, and so people can find exactly what they need. And our goal, hopefully, like later on when we have more, is to have like a section in our website and also in our YouTube channel where you can separate those. At Instagram as well, we can separate by our reels, by our shorts, the shorts that we are sharing. So we can hopefully create those sessions soon. We have right now, I believe that 10 episodes available, like recorded, a few more coming. So we need to have a few more to be able to create that. Thank you.
Yeah, we're trying to think about what we can do more nationally as well. I mean, not we. Camila is telling me what I need to do more nationally, and where we can gain this access and just conversations. Like these conversations are very helpful to us. This is not our forte. The content is our forte, but how to disseminate it, do it more efficiently. It's wonderful. This is the beautiful thing about being in an academic environment. Somebody always knows more than you. And that's why I've always stayed in an academic environment, because it just makes you better. So we'll certainly, take this nationally, get people to talk about this and give us ideas about how we do this. We've seen other podcasts. We looked at all other podcasts that were out there done by psychiatry programs. And we noticed that they tended to fizzle, that they started out doing one a week, and and there was usually one motivator behind it, and then it would fizzle if something happened. So we're trying to set ourselves up for the long haul, and that's why we have a board, and that's why we have multiple people who are sort of in charge and focusing energy on this, so that it's not all on one person. But we'll see.
Yeah.
We're trying not to do that. Sure.
Sure.
So I just want to say, I told Tracey, I work at Dartmouth up at medical school up in New Hampshire, and I told Tracey before this started that last week, all our new president invited all the living surgeon generals, and there were about 8 or 9 of them, and it was about mental health crisis in the country, at campuses, and so on. And Sanjay Gupta was the moderator. He was fabulous. But anyway, they all talked about the need, to push the ball downfield to do something about the mental health crisis. But they said things like, well, increase awareness. There was nothing specific. So I just want to say that coming here and listening to what you're doing is the first specific thing that can be done to improve mental health awareness and education and so on. So it was pretty cool. Thank you.
No, you're welcome.
Thank you.
I mean, I have a lot of things we should do, but I think that they're all, humans are only meant to go so fast, and we're going much faster than we should. And that's part of our problem. And we don't want to acknowledge or recognize that, but we're going too fast. And things break down when things go too fast. And so I think when people talk about self-care and all these other things, they add it on as, okay, well, now I'll do all these other things and then I'll do self-care. And that's probably not the way to go. We're not meant to go this fast for this long. And we're testing the limits of our abilities. And some of the cracks are showing, is what I would say. You can't add on too many things, particularly if they're not in line with who you are as a person. If you're not in line with your core values, you'll definitely, those cracks will show earlier.
Indeed. Any other questions?
I don't have a question. Well, I said this question. Thank you. I know a lot of people are benefiting from mental health apps in terms of like getting actual practice into their lives or getting information for their own personal well-being, and people, I think, benefit a lot from those. But my employer has a benefit related through, I think it's called Better Health. And I think on those apps, a lot of times they have resources, and that's a like potential distribution mechanism, because I think they have a lot of companies that are their clients, and then you can kind of drill down into areas that you're interested in. So I don't know whether they charge you for that, but I just thought I would mention that, because at my company, I would say some of the most well-attended like online things about benefits is when they do the Better Health, like mental health application. So I think there are some resources, like that's a distribution. I'm trying to think of like bigger distribution opportunities. So
thank you. This is
just an idea.
Yeah, this is an excellent idea. We have been like discussion about how we can amplify that. So this is definitely a channel that we could reach out and see how we could make this happen.
Now that we have 10 episodes, we probably look like we're like semi-real now. So maybe someone will take a look at it. But you're right. Some of those apps are really helpful. The Calm app. There's a lot of things out there that teach very concrete things like belly breathing and things like that to help people in times of anxiety that are very helpful.
Yeah, and just to add, another thing that we are doing right now, we are incorporating to our media platforms resource to facilitate access to care. You see that in each episode, we address like and mention local and national resource. And so now we incorporate that, we are working right now in our website to bring those information at the end of each episode so people can access there. So this is something else that we hope to accomplish with this project. Thank you again for your idea. Like it.
Other questions? Yeah.
I have a question, actually.
Sure.
I really appreciated what you said about teaching residents about impacting their community, and you sort of using this as a teaching tool. So I'm curious what you think the impact on residents has been.
Yeah, so we have been, we are right now also preparing a series that we address that. And we have heard from the residents different things. One of them, it's how it's common for us in our field, usually having the patients coming to us when they need to our clinic, to our hospital. So for them, it has been a great experience being able to reach this community through something like that. Also, another thing that they are appreciating is that many of them are like stepping out of their comfort zone to be able to sit there with us and like work as a co-host, asking questions and provide information. So they feel that is adding to our education. And this was another thing that we are like aiming to accomplish with that. Provide to the residents this like channel where they can develop also their skills and like their communication skills, how we can like get out of our medical lingo and be able to to use conversational language and make those like heavy topics, because we know that it's not easy to talk about that, but how we can make that more palatable, more simple, so everybody can reach. So they are appreciating that a lot. When we start, we had like, I think that 6 residents with us. Right now, we have over 50% of the residents embracing the project, and we can see that more and more people are becoming interested. We have a series coming soon in our Instagram with shorts, with the residents mention how this is like affecting their experience and what they see that they are doing for the community.
Let me just respond to this one. Okay, let me get back to you for 1 second. So I think that I always have a not so hidden curriculum, a not so hidden agenda. And one of the things that happens when you're in residency is it's hard, right? You leave medical school, you come out idealistic about how you're going to help people and save people. And then you realize that there's this computer that you've got to check all these boxes in, and there's all these things. And then, oh, if this breaks, I can't do this. There's lots of systemic issues that cause difficulty in you accessing what it is that you really think you need to do. And when you go through that and multiple different rotations where there's some struggles there, or you can't get the person connected to exactly what you think they need to be connected to because of their insurance or where they live or transportation or other issues, you can become demoralized. A demoralized doctor is a dangerous thing. So we don't want doctors to be demoralized. So we have to insert in places in the residency things where they feel connected to what drove them to be a doctor in the first place. And one is to make a difference, right? So people want to make a difference. And I think when they come here and they sit with a senior person to see their knowledge and how they're using their knowledge and see this platform and did this work and then publish this thing, they feel connected to a core value. And I think that that's incredibly important. They may not recognize it, but I do. And they'll recognize it later. But right now, it's unbelievably important to me that that happens. And that's why it had to be in the residency program. And that's why it had to be community-based. And that's why we have other things in the program to focus more on community in places where all of these other systemic obstacles don't exist. Don't exist. I'm sorry. Thanks for waiting.
Of course. And I actually have to apologize because I came in late and you might have addressed this already. I was just wondering first whether you would be dedicating time on the podcast to teenage girl mental health issues, and also about the intersection or relationship between mental health and addiction. Most of the addiction podcasts and resources relate to adults. And when people address children, it tends to be adult children. And the recommendation is, from some people, kick them out of the house, all things that really aren't possible when you're talking about a young teen and how to handle those issues.
Yeah. So we're, thank you for that question. We are very fortunate here at Brown that we have we have a very large child psychiatry and psychology fellowships, residencies, postdoctoral fellows that are researching everything. And we are very committed to spending a lot of time dealing with issues with child and adolescents. We did one podcast so far on child and adolescent mental health. But yes, we're going to get more specific about substance use. And we have a lot of expertise that we can draw from. we certainly can think about, the transition points for teens. There's times of, distress that happens, and how to best help your teen, through that, or what are the resources that you can find to do that. I think that's an excellent idea. But yes, we will definitely be spending a lot of time on childhood mental health, child and adolescent mental health, and addiction in particular, because it's a very big problem, particularly with marijuana.
We are able to touch a little bit like this topic in the last episode. We are releasing today the second part of the addiction episode, but we agree we need to address that specifically. And this is what we hope to do ultimately, is to have those different series where people can go, okay, this is child and adolescent mental health. Right. And so they can access that. But this is an excellent point. Thank you.
Ideas, recommendations,
suggestions for
we're
topics.
open for suggestions for podcasts. We're open to.
All right, if there's no other questions, we'll just end with a wonderful thank you so much.
Thank you
time.
so much. We appreciate it. Thank you.